Is above 100 possible without IV iron?
Yes, it is. Although if you are low, so patients who have had an acute event, usually surgery, for example, that kind of thing, some trauma where there's been blood loss, they can respond because in theory it was a one-off event and they can respond. It's going to be slow. It's going to certainly be way slower than IV iron, but it certainly is very difficult to raise your iron when you're deficient back to a normal state. It's very hard, for sure, as I'm sure you see.
Well, I guess the main population that I see that is in such desperate need is women of menstruating age.
Yeah.
I actually don't think it's possible to get an iron over or a ferritin over 100.
No.
And a lot of them will say, if probable is up to 50 and possible is up to 100, can I get past 100 and know that anything that I'm feeling, the complaint that I'm coming in with, is not being made responsible by ferritin?
Yeah.
Is that it's probably hard to see 100 ferritin in those women.
Well, no, I mean, we obviously, the ones that come to us never have it, and they'll say, I've never been above 30 in my life, and I think that's another failure that we have done, is that we've almost just accepted that's a norm for menstruating women, and it's not, and it doesn't have to be. And one of the nice things too, and for reasons that aren't quite known, is that once your ferritin does get above 100, it's actually easier to maintain it once your ferritin is high with oral means. And so a lot of our patients after treatment don't have to come back, even though they have this, the same cycles, that kind of thing. And so it is possible, but I think so many people have said, well, until you go through menopause, this is your normal kind of thing, and that doesn't have to be.